Good evening, listeners. Welcome to Views on Health. A great pleasure to have with me back on the program Dr. Thushan Gunaratne, Consultant Vascular and Transplant Surgeon, Colombo North Teaching Hospital in Ragama. I'm sure listeners will recall Dr. Gunaratne speak on deep vein thrombosis the last time around. The topic under discussion tonight is diabetic foot. Without any further ado, the microphone is yours, Doctor.
Thanks, Fatima, and thank you for inviting me again. And good evening to you as well as all the listeners on the show today. So diabetic foot is something I chose. It's been a common topic amongst vascular surgeons for a long time, but it remains a problem. When you look at diabetes, it's more of a general physician topic. People wonder why a surgeon would be getting involved in something like diabetes. And they're right, diabetes is a very common problem. We don't know exactly how common it is in Sri Lanka, but figures would say close to 10 to 15% of the population has diabetes. The problem lies that people with diabetes, a certain percentage of them, around 25%, so 1 in 4 people with diabetes will end up having a wound in their foot. And that's a diabetic foot ulcer. What is also shocking is that amongst people who have had a diabetic foot ulcer, so let's say Sri Lanka's population, well, let's say it's 20 million, for example. So 10% have diabetes, that's 2 million. Of them, 1 in 4 will have a diabetic foot ulcer. So that's 250,000 feet that are having ulcers. If you look at diabetic feet with foot ulcers, 1/3 will end up losing their legs. Those are shocking numbers for a country. What is even more worse is that if a person has had an amputation, that they lose the leg, around 50% will not be alive by 5 years. Those numbers are far worse than any cancer that we have in our country right now. The worst cancers have better outcomes for a person. If you lose the leg above your knee, 90% will be dead in 5 years. So shocking numbers. Why we talk about this is that important to understand that this is all preventable. And that is where we, as vascular surgeons, together with the whole team involved in diabetes, are emphasizing the need for foot care. So I think as common and as many times it's been discussed, I don't think it is too much to talk about. So in terms of diabetic feet, it's important to sort of understand as to why these people are at risk. Let me ask you a question, just out of interest. What do you think is the commonest cause of losing a leg in Sri Lanka?
One would think it's an accident.
Yeah, absolutely. There's a time when war, landmines and RTAs were the primary cause for losing a leg, and that was a very common cause. Luckily, law is no longer an issue. Landmines have been cleared, and the reality is that diabetes is the commonest cause of losing a leg in our country, and that is a global event as well. It's important we try and figure out why this happens. Diabetes, as we all know, is a multi-system disease. It affects the entire part of your body, your vessels, your nerves, your skin, your immune system, your joints. Everything is affected. A whole body weight lies on these 2 feet, on the small surface area of those 2 soles, which is hardly a square foot together. A lot of pressure that happens on those places. The foot is such a marvelous organ. A lot of dynamics are involved in making sure it's a nice balance of weight is involved in them. The arches are there. The structure is designed to make sure that the pressure is equally divided. Diabetes affects the nerves. Your feet are going to be numb. It affects your vessels. Your vessels might be blocked. It affects the skin tone, skin texture, dryness is there. And you lose your architecture of the foot. And all these puts a risk on getting a foot ulcer. So that is why diabetic feet and diabetic foot ulcers are a problem in our country.
Doctor, when you put it that way, it's really alarming. Very alarming, I would say, because one would never have thought it could be compared to a cancer, where you say the outcomes are better. Can be better too if they are detected early. But here, that fact that you lose portion of your limb, then your lifestyle also is going to, come to an end soon.
Absolutely. And we find younger and younger people involved in diabetes. And these are patients, people in their young livelihood where they are earning. They cannot go to work sometimes. They lose their jobs, lose their employment mechanisms. Their lifestyle is affected. It's really important that if you start off early, if you take care of your feet from the beginning itself, then you can actually stop yourself from getting there.
Studies show that diabetes is said to even take over from ischemic heart disease in time to come as a leading cause of death. Please correct me if I'm wrong.
I couldn't be. I think you're right on that. I think what's very clear is that the subcontinent is going to be the diabetes hub of the world. India, Sri Lanka, Bangladesh, Pakistan, we are at very, very high risk of being a diabetic endemic area based on our lifestyle and our diets and everything. So we are going to be high risk for diabetes, and it's very likely, like you said, that it will overtake ischemic heart disease even in the future to come.
So having that sort of outlook in the foreseeable future, how does one contain the problem?
It is, in fact, as simple as it can be. There are very little things that you need to do to make sure you are looking after your feet. A couple of things to diabetic foot. It is part of your body. So it's important that the whole body is looked after in terms of your sugar control. And that is where the endocrinologist or the physician will make sure your sugars are up to date. So eating well, taking medicine, lifestyle is all very important. At the same time, you should pay equal emphasis to your feet amongst your eyes and your kidney and everything else. This is a very simple thing you to do. All you got to do is look at your feet every day, 5 minutes before you sleep at night. It's as simple as that. Inspection of your feet daily is very, very important. And a 5-minute inspection at the night before you sleep is good enough to pick up most problems. So when I say inspect, you got to understand, you got to also look at the plant or the sole of your feet. It's not easy done for a person because it's difficult to see what's happening underneath. It's important you have maybe a hand mirror or a foot mirror, something like that, just to make sure there aren't any cracks, any blisters, any wounds, any injuries, any red spots, nothing too painful. Your nails are looking good. The skin is not too dry. Have a quick look. If there's anything unusual, go and see a doctor. It's also important you take care of your feet, and that is to make sure your feet are washed daily. You got to understand that some people have numb feet. Their feet are numb. You could step on your feet. You could be walking on the hot sun on a tar road, and they would know what is happening. So wash, but be careful in the way you wash. Don't rub vigorously. Do not test how hot the water is by putting your feet in. That's an essential no. There are enough people, enough stories of patients who have put their feet in hot water for a massage, and only to notice that there's a funny smell happening and the feet are being burned in boiling water. So always make sure it's lukewarm water, wash it, pat it dry, use some moisturizing cream on the dry skin. Be very careful that you make sure that the webs are not too wet. So no moisturizing cream on the toe webs. Make sure they're nice and dry. Spread the toes apart and make sure they're clean. Look at the nails. Do not cut the nails like we do in a curve. Diabetics have been told their toenails should be cut straight. That prevents an ingrown toenail from happening and inadvertent injury to the toes. If you do all of these things, that is fine. So look after them and make sure that your feet are cared for.
So in other words, doctor, if a person is a diabetic, he or she has diabetes, that is, they should look after their feet.
Absolutely.
And every night, inspect your feet, check them out, and ensure that you see nothing abnormal. You keep them clean, wash them regularly, dry as well as apply a moisturizer, but make sure it's all dry.
So make sure it's dry. Make sure the toe web spaces are dry; they're not moist. Make sure the skin on the top part of the feet are not too dry. So a bit of emollient, some Emoderm, some cream to make sure the nice skin is not too dry. Because when the skin is too dry, it can form cracks, especially on the sole of the feet. And those cracks are a focus for infection. The nails are the next critical point, and also the joints and everything else. It's important that for any person that they do all of these things. It's also important that you look at not only the feet but also the footwear, because you got to understand you are most often your feet are going to be in a shoe. It's very important that you look at your shoe before you put your shoe in. Enough times there have been pebbles, bit of glass inside the shoe that you haven't noticed before. It's important that your shoes are fitted for a diabetic person. There are special shoes, I beg your pardon, that can be used for people who are neuropathic. That are not too tight. Do not try and use rubber slippers where you wedge your first and second toe on a piece of rubber without knowing. Those are extremely dangerous if your feet are numb. Make sure that socks are nicely fitting. They do not have elasticated tops that constrict the legs. Any person with diabetes should really come and see a physician once a year. So you do your self-assessment daily, every day, 5 minutes. That's all it takes. That's less time than you take for your brushing teeth. Do that daily. Make sure your shoes are sorted out, and make sure you avoid barefoot walking as much as possible, especially if you are neuropathic. Even at home, our advice is to use some footwear. Do not assume your home is a safer place than the outside garden. It is not. So be careful in your shoes, careful in the way you look after your feet, and see a physician once a year if you are a diabetic person.
Juxtaposed to that, doctor, is that the medication has to be taken on a regular basis, which the physician would have prescribed, and then lifestyle and diet. I mean, part of lifestyle is the diet, of course, and then proper hygiene and exercise. Regular things that physicians have spoken where diabetes is concerned. So all of that is advocated too.
Absolutely. So that is a normal person. So these are things that every diabetic person should be doing. Things become a bit tricky when there are reasons why they're at higher risk for having a diabetic foot ulcer. If you don't mind, I'll just have a quick chat about those before we finish. So anybody who is neuropathic, they're at a higher. So not everyone is neuropathic. A lot of diabetics have sensation, have a feet that are sensate. Some people's feet are asensate. They're at a very high risk. There are some people who have issues with their vascular supply, and a physician might say that they couldn't feel a pulse, for example. And it's very important that they are more careful. We have a nice foot with a nice arch. And some of us have flat feet by birth, but in diabetes, the deformity in the way the foot is structured happens with time. And if you have such deformities, if there's any abnormality in the way the foot lies, you are at a higher risk of having a problem. If you inspect your feet, sometimes you find thickened areas in the sole of the foot. This is a natural process that is done by the body to safeguard itself, but these are called callosities. Ulcer almost always is preceded by a callosity. These callosities, if you keep on walking on them, they press inside and forms an ulcer inside, and that's one that erupts outwards. So looking after these callosities is very important, that you see someone who will look after them, who will shave them, who will make sure that they don't cause harm. And fourth and fifth is your nails. Looking after nails are very, very important. If you have had an ulcer before, there's a 40% chance you'll have another ulcer over the next 2 years. So you are at a higher risk. If you have lost a digit, for example, some people are able to get away with losing a toe or maybe 2 toes if they have ulcer. Those people are also at a higher risk. So if you are in that high risk group, we would advocate seeing a consultant involved in diabetic feet more regularly, sometimes every 3 months. As long as you make sure you see someone, you look after yourself, and you see early signs of a problem happening, then we and other surgeons can get involved to make sure they do not progress to a point where you lose your leg.
Can an ulcer manifest in another part of the body?
It can. The worry part is when it involves the feet, because you are at a higher risk of losing your legs, as it goes. But you are at a higher risk of having abscesses, infections in any part of your body because of the diabetes and its involvement on the immune system. But really becomes a problem when it involves the foot.
So, doctor, you said within 2 years there can be another ulcer.
So 40% of people...
It takes that long?
No, it can be a lot sooner. But what is worrying that it's easy to be complacent once you have an ulcer and you are in the lucky group that the ulcer healed. It is very easy to be complacent. Think, I had the ulcer, I got away with it. But you must remember that you are at a high risk. 40%, 4 out of 10 people who have ulcer will have another ulcer, and that is within the next 2 years.
It will recur.
It will recur. Not necessarily the same point, somewhere else in the foot, because of the risk involved. Therefore, you are never really safe from losing a leg if you had an ulcer. If you haven't an ulcer, you are in a very lucky group. You got to make sure you look after your feet so that you do not get into the point of having an ulceration.
So the worst case scenario, at which point does the unfortunate aspect of amputation come in?
So when we encounter such patients, often they have either self-medicated or it's been missed. And you got to understand diabetes affects the way the body responds to infection. It is often very common to not have a wound, but to have an abscess underneath, and it doesn't show like you or me. When the patient comes late and there is sepsis setting in and the infection has progressed, then it becomes a problem. When this infection is combined with a vascular insufficiency, then there's a bigger problem. Those patients are even a higher risk, and we need to think about optimizing the blood supply by surgery to save the legs. When you reach those points, the risk of losing a leg is higher and higher. We as vascular surgeons are always promoting limb salvage. Many limbs that would have been amputated, we sometimes strive and get blood supply sorted out, correct deformities, do whatever we can to save the leg. It's a lengthy process. Not everyone will succeed, but it can be done in the right patient and the right wound, the right leg.
So, doctor, anyway, that's not the best of situations. And if it happens in one leg, can it happen in the other leg too?
Absolutely. Any change in the foot structure in the opposite leg will affect how you are walking on the opposite leg as well. If you had an ulcer, if you had deformity, if you had an amputation, the load on the other leg changes, and that will affect the other leg, and it will put your other foot at risk of having ulcerations.
So then that is something that one has to expect.
One should be aware of, I think it's a better word, and therefore if you are aware of it, you can prevent it. These are all preventable. It's not like a cancer that you, once it sets in, you can't sort out. If you know you're diabetic, you know that there is such an outcome, and you can look after yourself, look after your feet to prevent yourself from getting there.
So it's like going back to the drawing board and treating your diabetes correctly, dealing with that to prevent this happening.
Yep. Make sure you deal with the diabetes, and make sure you do not ignore your feet at the same time. A lot of emphasis on the eyes to make sure you get your eyes checked. We often forget you use your feet as much as your eyes. And it's also important that the outcomes of losing a leg are so bad, are so tremendously worse than one would expect, that we should not ignore it.
Like you quite rightly said, doctor, I think generally people tend to focus more on their eyes and other parts of the body. Say they get a wound, say there's a cut or something, they think, oh, I'm diabetic. I need to see that this wound heals.
Exactly.
But all the time, its a focus is not so much on the feet, but you are laying so much emphasis on the feet.
Absolutely. And you're very right in that. We are not, the body is healing differently. infection that is very trivial to someone is not trivial for a diabetic. A small cut in the nail is enough for you to progress to a point where you lose your foot if you're not careful.
As simple as that, and it has grave on the other side.
Absolutely.
So that's very frightening. So, doctor, you have given a very, very sort of, I would say, comprehensive explanation to this whole issue of diabetic foot and the importance of taking care of one's feet if you are a diabetic. Now, and then the worst case scenario is that you can have your foot and then maybe both feet or parts of the leg amputated. And that impacts on your life, literally on your life.
Yep.
So it's so tricky. Okay, are more men or women affected? Or is that not a gender thing?
It is not really a gender thing. I think it is more of a lifestyle, your livelihood, the lifestyle that affects how diabetes works. Once you are diabetic, there is no bar in terms of age or gender or ethnicity or your employment. It affects, unfortunately, everyone equally, and everyone needs to be equally safe and careful. What are people who are at a higher risk are the people who are overweight, who have other general involvement of, for example, the kidneys are also affected, the eyes are affected, they got numbness, they are more at higher risk of falls, for example. People who have less social support are at a higher risk of having ulcers and amputations. People who are involved in work, walking, they're all important. And sadly, our health system cannot afford to supply enough funds to provide foot care or footwear from a national point of view. A lot of people walk barefoot in our country. That is our culture. In a temple or a holy place, we are asked to take our the shoes off and walk in the hot sun. That is not on. We've got to understand that you look after your feet and be sensible about it. Make sure that your feet, foot care and your footwear are equally important.
Just one final question. You spoke about age. Childhood diabetes is quite common in Sri Lanka, from what we gather. Please comment on that.
I think so. I think we're seeing more and more type 1 diabetes. Perhaps it's the awareness of it. Unfortunately, it's a common problem. Child obesity is a problem in our country, and we are more likely to see a younger age group involved in this disease, and therefore they will have those complications, including diabetic foot ulcers, in the time to come.
So, Doctor, your take-home message?
Thank you for the opportunity about speaking about diabetic feet. It's a common topic, common problem. Often ignored is the diabetic foot part of this whole general problem. What is important to know is that the outcomes are worse than any cancer we know. What is also important is to know is that all of these can be prevented. 5 minutes every day before you sleep at night, foot care, looking after your feet with the appropriate shoes, and knowing when to see a physician who can help you with this. Those are 3 take-home messages I would like to tell. And if you do all those 3, you can look after both feet.
Good advice indeed. And there we end yet another interesting discussion, this time on diabetic foot. And place on record our most grateful thanks to Dr. Thushan Gunaratne, Consultant Vascular and Transplant Surgeon, Colombo North Teaching Hospital, Ragama, for being with us in the midst of a busy schedule and sharing your expert knowledge on the topic. Thank you so much once again, and my thanks also go to Manjula Seniviratna for technical assistance. I'm Fatima Razi Kali saying good night, and hoping we'll be together next Monday same time on Views on Health.